Hi everyone. Today we'll be considering a basic and one of the most important aspects of the human biochemistry, and which is calcium homeostasis. Calcium homeostasis is one of the main key inorganic substance that is going to cause 99% of your bodily actions. So we'll be discussing about the calcium homeostasis in this video, after which you will be able to understand so many symptoms that a patient suffer are because of either calcium excess or calcium deficiency. This will help you understand clearly whether this remedy is to be used in which conditions. Although in many of our remedies it is written to be rickety, but there are another many symptoms which are there in the remedy which are related to the higher calcium levels. So currently the Materia Medica is not so effectively written to differentiate between the symptoms that come in the earlier stages and the symptoms that are coming in the later stages. It is more being done in the form of organ symptoms, not in the stage sequence symptoms. So here we will be outlining about the calcium. First, we'll introduce you to the calcium, then the calcium metabolism, and the hormones or the uh, agents that affects the variation in the calcium levels, that is parathyroid hormone, calcitonin, and vitamin D, functions of the calcium, disorders of the calcium, and finally we'll summarize it. So in the introduction, we are describing you that the total content of the calcium in the body is around 1300 grams, and out of which 99% is in the bone and 1% is in the intracellular space and 0.1% is in the extracellular space. So total plasma levels, you have to understand whenever you see a report, the total plasma levels is 2.5 millimoles and it ranges from 2.1 to 2.6. An important thing is to remember is that it is very tightly controlled in the blood because it affects the cardiac function, it affects the neuromuscular excitability. Now, in the introduction, we are explaining you that in which format the calcium is present in the blood. 40% of it is present in the protein-bound form with the albumin, and 60% is in the unfilterable, that is the complex ions or the ionized form. The ionized forms is the charged ions. Now, the factors affecting the calcium concentration in the plasma is number one, the protein concentration. So whenever the protein is increased, the calcium total increase, it increases the total amount of calcium. And second, changes in the anion concentration, that is increased fraction of calcium that is complex and decreased ionized count. So whenever the excitability has to be reduced, the ionic form of the calcium is reduced and it turns into an anionic form. Or you can say whenever the energy is discharged, then it turns into an anion form. Acid-base abnormality. It is used in the acid-base abnormality to correct it. So here in the acid-base abnormality, understand that the albumin is attached to the hydrogen and calcium ions, and hydrogen is the acidic form of it, and the calcium is the base form of it. So these two things, they compete to connect with albumin. So whenever there is acidity or acidemia in the blood, then the hydrogen ions are picked up by the albumin to reduce the acidity of the blood. And whenever there is an alkalinity in the blood, the calcium ions are picked up by the albumin to reduce the ionized calcium available in the blood and thus reduce the alkalosis. Now, the function of the calcium, it is majorly in the nerve and the muscular function, so whenever there is a decreased extracellular calcium, there is an increased excitability of the cell. This is how we explain. The decreased extracellular calcium will increase the negative potential of the cells and they become more excitable. Since calcium is 2 plus, it has the positive potential. So the action potential goes into fire whenever there is more calcium in the extracellular space. This extracellular space calcium comes out from the cells as a shift. So the symptoms that are presented are tingling, numbness, and spontaneous twitches. Functions of the calcium. One is homeostasis, that is activating the clotting enzyme in the plasma. So all the platelets are rich in calcium, and whenever there is a requirement to or the injury to the cells or the tissues in the perivascular space, it releases these factors from the platelets mediated by calcium. So calcium helps in improving the strength of the fibrin that is being created and clumping of the fibrinogen. Now, functions of the calcium is third function that we'll discuss about is preserving the bone density. So there is a constant bone resorption, bone formation, and the bone mass buildup. So this is how the bone is being constantly reviewed from various spaces. Whenever there is an osteoporosis, there are certain spaces where they starts hurting earlier than any other spaces. So those spaces are where the calcium gets resorption faster. Calcium, functions of the calcium. Then there's the fourth function is into the neurotransmitter release. So directly it is proportional to the calcium levels. Arrival of the action potential in the axonal terminals. It opening of the voltage gated calcium channels. These voltage gated calcium channels, they influx the calcium into the terminal and vacuoles, which are the transmitter vesicles fuse with the release sites. This releases the transmitter into the cleft. So this happens in a fraction of a second only. So this helps in the neurotransmission. Then fifth function is to assist them in maintaining all the cells in the connective tissue in the body and regulating the mitotic transition and the cell division. So calcium, whenever gets influxed into the cells which are dead or which are not functional, it turns them into eosinophilic cells, and there it basically guides the macrophages to get to eat them up. Essential components in the production of the enzymes, hormones, and regulate digestion, energy, and fat metabolism. So, calcium is the essential cycle state of the releasing of any hormone and enzymes. The blood calcium is tightly regulated, and the principal organs that are involved is the intestine, bones, and the kidneys. And the hormones that are involved is parathyroid, vitamin D, and calcitonin. Now we come down to calcium homeostasis and how it does is happen. 1000 milligram of calcium when you eat, it gets resorbed in the intestines with the help of vitamin D and vitamin B12 because it requires an alkaline medium to be absorbed. If it is an acidic medium, then the less amount of calcium gets absorbed into the extracellular fluid. So if 350 milligrams is getting absorbed, it gets converted into the bone with the help of thyroid hormones or parathyroid hormones. Hmm. So this extracellular calcium, which gets absorbed from the intestines, it gets deposited in the bones in the form of bone. And whenever required, it gets converted into this blood calcium levels through parathyroid hormone and calcitonin to get absorbed in the cells. So there are four parathyroid glands that are located in the dorsal side of the thyroid, and those are the glands which are effectively causing release of the parathyroid hormone. The chief cells secrete the parathyroid hormone. That is a basic physiology that we are discussing. And then there is a regulation of the parathyroid hormone by the plasma calcium concentration. So it is not the plasma calcium concentration that regulates the parathyroid hormone. It is the phosphorus concentration that regulates. So whenever there is a high phosphorus levels, as you can see, whenever there is an increase in the calcium concentration, not the calcium concentration, it basically inhibits the parathyroid hormone secretion. But whenever there is an increase in the phosphorus concentration, it releases the parathyroid hormone. So extracellular calcium is decreased and there is an increase in the PO4, that is phosphate. So this causes release of the stimulates the parathyroid hormone release, which helps in resorption of the bone and release of the calcium in the blood, and later on it reduces the release of the calcium in the urine. So it hypocalciuric action, and the high phosphorus levels, they get released in the urine through parathyroid hormone action, and you get phosphaturia. These are important aspects that we are discussing right now, which will help you understand many remedies like acid nitricum, where you have phosphaturia or there is high phosphate load in the blood urine. That happens only and only if there is a parathyroid hormone release is happening. So this parathyroid hormone is helping the people to improve the calcium levels of the blood. But due to high phosphate release in the blood, in the urine, the patient starts losing weight, as you see in the acid nitrogen cases. The first parathyroid receptors are on osteoblasts, which initially form the bones, and then later on it causes the resorption and promotes the bone resorption and increase the calcium concentration in the blood. So there are certain processes. We don't have to go into the nitty-gritties of the each and every process. What you have to understand is all the phosphorus levels are connected to the calcium levels, and they are in the inverse proportion to it. So whenever the phosphorus rises in the blood, that means the calcium has gone low, and the phosphorus stimulates the resorption of the bone. And after the calcium has been released into the blood, the excess phosphorus that is circulating in the blood, that gets released into the urine, which we call phosphaturia. So it is a complex process of calcium and phosphorus, uh, and stimulates the resorption of the bone. So phosphaturia plus calcium plus resorption is equal to increase in the calcium concentration. This I have explained in another terms, not in the terms that it is written here, but you have understood, I hope. Then action in the small intestines stimulates the calcium reabsorption via activation of the vitamin D. So parathyroid hormone stimulates uh, three areas. One is from the bone resorption, another is from the kidney uh, reabsorption and not leading to the loss of the calcium. And third is the intestines, from where the calcium is not where the calcium is getting absorbed from the intestines. So these three areas parathyroid hormone affects in association with vitamin D. Specifically in the kidneys and the intestines. Vitamin D is must to improve the calcium absorption into the blood. Now, actions of the vitamin D are majorly again on the bone, kidneys, and the intestines. In the bone resorption, calcium and the phosphorus increases, causes bone resorption in presence of vitamin D. Then in the kidneys again, vitamin D helps in improving the calcium reabsorption as well as the phosphate reabsorption if the patient is already low phosphorus in the body. And that happens in the cases where the patient has ulcers, mouth sores, or anywhere the healing is slow. So there the phosphate level of the body has gone low. And intestines, it increases the calcium reabsorption and phosphate reabsorption, synthesis of the calbindin D28K. Okay. Vitamin D, common diseases related to vitamin D is rickets, insufficient amount of calcium and the phosphate to mineralize the growing bones, and growth failure and the skeletal deformities. Osteomalacia, new bone fails to mineralize and bending and the softening of the weight-bearing bones. Now, calcitonin. We come down to the second hormone, that is calcitonin, the third hormone, that is calcitonin, and it is a straight chain peptide of 32 amino acids and is synthesized and secreted by the parafollicular cells of the thyroid glands. Major stimuluses for calcitonin release secretion is the increased plasma concentration, calcium concentration. So, as we were studying in the first picture, where the calcium has been supplemented to the patient with 1,000 milligrams, and the intestines have been absorbing the calcium, where now this absorbed calcium in the extracellular space will stimulate calcitonin to improve the bone density, to get it resorpted into the bone. So major stimulus for calcitonin secretion is the increase in the plasma calcium concentration, and the major action of the calcitonin is to inhibit the osteoclastic bone resorption, which decreases the plasma calcium concentration. Not exactly decreases, it reduces the concentration to the appropriate levels. So calcitonin does not participate in the minute-to-minute regulation of the plasma calcium concentration in humans. A physiological role of calcitonin in humans is uncertain, because neither they do say uncertain, but when you will go through our homeopathic medicines, you will find everywhere and every aspect of the human homeopathic medicine is stimulated and affected by the calcitonin. Calcitonin becomes the silent background hormone that is leading to the actions of the homeopathic medicines. Now, calcium handling in the nephron. Calcium handling in the nephron happens with the help of parathyroid hormone and vitamin D in the loop of the Henle. Okay? Calcium handling in the nephron, 67% of the filtered load is reabsorbed in the proximal convoluted tubule. And calcium reabsorption is tightly coupled to sodium reabsorption in the proximal tubule. So sodium acts as a co-transporter in many of the things. Even if it's the glucose or the calcium, the important key things are co-transported along with the sodium. So calcium handling in the nephron, 25% is of the filtered load of the calcium is reabsorbed. The mechanism of coupling in the thick ascending loop of depends on the lumen positive potential difference and is generated by the sodium, potassium, and 2Cl co-transporter. Loop diuretics such as furosemide inhibits the calcium reabsorption in the same extent that they inhibit the sodium reabsorption. Calcium handling in the nephron, in the distal tubule, 8% of the filtered load of the calcium, the site of the regulation of calcium. This is basically the final reabsorptions, which happens only if the patient is deficient. Then they will open up the distal tubule, reabsorption 8% of the calcium, thereby reduces the loss of the calcium in the urine. So it has its own regulatory hormone, that is parathyroid hormone, which works majorly at the level of the distal tubule, the final and the last 8% of the resorption. Thiazides are the drugs which increase diuretics that increase the calcium reabsorption, while the other classes of the diuretic decrease it. Now, hypocalcemia. It is one of the state which is so common in our homeopathic remedies that we have to understand it very clearly. Hypocalcemia is the main key biochemistry changes which is responsible for convulsions, arrhythmias, tetany, and the numbness and paresthesia in the hands, feet, and other mouths and lips. So you will find that all the venomous remedies are affecting the calcium levels of the blood, thereby causing all these symptoms of arrhythmias, tetany, numbness, hyperesthesia, paresthesia. Then there is a also sign of latent tetany, eliciting powerful spasm by inflating the blood pressure cuff and maintaining the cuff pressure above the systole. And tapping the inferior portion of the zygoma can produce the facial spasm. These basically shows the hypocalcemic state of the blood. Then there is a hypercalcemia. This happens when the parathyroid, it is majorly mediated through parathyroid hormone, but there are other causes also. Which are mentioned here. I'm not going to describe, I'm not going to repeat all these things. Why? Because these are each and every separate disease which needs a longer duration of discussions than just by mentioning it. So just go through these diseases where it is hypercalcemic. So hypercalcemia will cause stones, bones, groans, drones, and psychiatric overtones. This is just a key to understand what hypercalcemia can do. So it causes stones in the biliary and renal stones. But here the secretion of the calcium into the biliary and the renal is mediated by certain other hormones apart from parathyroid hormone. Here we call it the other hormone is majorly the prolactin. It has got psychiatric overtones because of the prolactin hormone, which is very, whenever it goes high, it causes many calcium related issues. So it doesn't let the calcium go inside the cells, and it will always keep the hypercalcemic state of the blood. Uh, it will cause all the autoimmune diseases due to the hypercalcemic state, and abdominal pain, nausea, vomiting. Then there are Crohn's, that is polyuria, and psychiatric overtones, depression of 30 to 40%, anxiety and cognitive dysfunction, and sleep insomnia and coma. This is actually not the hypercalcemia which is leading it. It is basically the calcitonin has been kept away. The calcitonin is not allowed to come up to give the calcium to the cells. So it is negatively affected by the prolactin levels. Calcitonin and prolactin are opposite to each other in action upon the calcium. So calcium is crucial for the body physiological function and must be tightly regulated to maintain the physiological stability by interaction between the major organs, that is intestine, kidneys, and bones, and the hormones. Then a decrease in the calcium levels stimulates parathyroid hormone release, increase in the bone resorption, increases the calcium resorption. From the kidneys, and increase in the calcium uptake from the GI. Vitamin D, same action, but increases the phosphorus resorption also from the kidneys. Calcium imbalance can be recognized and treated early to prevent the any catastrophe. Thank you very much.